Hi there, everyone. I'm here with a very interesting case today because there was a recent case of intrauterine growth retardation in one of my patients. I would like to discuss that case, in a brief detail with you so that you understand how to use and how homeopathy can be really helpful for you during your pregnancies. This is Dr. V, and I'm here with you discussing pregnancy and homeopathy today. Um, all right, diving into the case first, and we can probably talk about what I do personally later. This is a recent case of a very young female, all of 32 years old, who consulted me for intrauterine growth retardation. So, I will give you a brief history. It wasn't like an extremely simple pregnancy for her. She is thalassaemic minor as well, and she was having severe anemia for that. And she was going through blood transfusions because of the low iron levels due to the thalassemia minor. At the same time, there was a history of recurrent miscarriages as well in the last two pregnancies. So it wasn't like, a classic case, or there were some issues in her pregnancy. Um, this is the basic history that I got from her. And currently, what was going on was that she was getting nosebleeds. Whenever she would go for a blood transfusion, she would get a nosebleed. So that also was not, her body was basically reacting to, you know, the transfusion itself. And the main concern, what she consulted me for, was this growth retardation. And um, she was suggested C-section because they were very concerned about the health of the child, and it was kind of a danger to the life of the fetus, of course. She was kept in the hospital, and she was undergoing about 3 to 4 Doppler ultrasounds every day because they were wanting to uh, monitor the progress of the case and the status of the fetus continuously. So she was in the hospital for, already a few days now, and there were no changes in the status of growth or blood flow to the fetus. So everything was looking a little grim. And they were suggesting that please go ahead with delivery at the seventh month because uh, the child is in danger, and the fetus will not be able to grow properly now that there is restricted or almost no blood supply to the fetus as well. At this stage, this was the when she consulted me, this was the current condition. I took a very brief case, to be very honest, because in such a case, as a homeopath, we need to first avert the danger to the fetus. The history and everything we can deal with as a second or third layer. But the first thing was to, make sure that the blood flow to the fetus returned, or at least became better, and the fetus would start growing, if not 100% normally, but at least some growth should be seen, every week. And obviously, the aim is to avert the early C-section because we do not want an early delivery at seventh or eighth month. Um, I think we all know this, that if a child is born preemie, then they can suffer from very bad or low immunity, and they can have multiple issues later in life, as well as of course the NICU that they have to be kept in for sometimes 15 days, sometimes a month, until the child can survive without the NICU without the special NICU conditions. So this was the main issue at hand when she consulted me. This was not very long back, to be honest. It was barely 2.5 weeks back. And when I took her case, this was the main concern. So I always, obviously, we ask as a homeopath, we have to ask what is the stress you're going through right now, in case any. So the young patient, she said that I have been a little stressed, in this pregnancy because I'm not able to do my work properly or meet the deadlines properly, and I'm feeling like I'm completely unfit for the job that I have, and I'm not able to cope up with my work. Since this pregnancy started, I have been having these thoughts, and I have been quite stressed about my work. So this was the only relevant thing that I got from her in her mental state, and the physical manifestations that were, very, very urgent at this time. I would like to, at this point, I would like to share my screen and show you something, because this is what led me to prescribe this particular remedy to this patient. I hope you can see my screen now. If you can see, can you see this? Delusion, imaginations, unfit for work. Delusions, imaginations, unfit for work. And if we see, there are about 5 to 6 remedies here. And one of the remedies, as you can see, it's aurum mur natrinatum. All right. Here, the first remedy mentioned is aurum mur natrinatum. All right. And then there are others, of course. So, if a little bit that we know about, aurum mur natrinatum is that it has a very specific action on the uterus. So that, fit this case quite perfectly, because we wanted a remedy with a good focus on the sphere of action should be the uterus, right? Because we are trying to improve the blood flow to the fetus here. So the physiology of the uterus is what we are aiming to correct, right? And I went ahead and I prescribed this remedy along with one more remedy, which is thyroidinum. Thyroidinum was prescribed in a low potency because it has, again, it has been known and it has been suggested by our stalwarts with, case references in our books, in our reference books, that it has a very good action if the growth of the fetus is interrupted or is retarded in the later months of pregnancy. So what I did was I just prescribed aurum natrinatum, which was obviously quite case specific, and I prescribed the remedy thyroidinum, which is a sarcode, which is a homeopathic sarcode. In this case, which was given every day, once a day. And aurum natrinatum was given just in a few doses for the initial 2 to 3 days. I think I asked her for, sharing her ultrasound, because they were doing the ultrasounds, the Doppler ultrasound, quite regularly. I just asked her to share the report with me. So sorry. I asked her to share the report with me on the 5th day, I think, after the remedies were started. And to my surprise, to my pleasant surprise, and to the patient's surprise, the blood flow had returned to the fetus. The growth, the weight of the fetus had already improved by 100 grams. And quite honestly, the message that she sent me was that my ultrasonographer was very shocked, to see that how can this change? This usually just never changes once it happens, it doesn't change by itself. And usually such cases end up in an emergency, C-section. So it's barely been a week now, and the child is continuously growing. And the growth is much better, the blood flow is much better. And all of this started showing, in the ultrasound in only 5 days, 4 to 5 days. We still have a month and a half to continue the remedies and to make the health of the fetus even better, because there was a certain history, complicated history in the pregnancy otherwise as well. So I'm planning to, keep treating this case until birthing happens at 41 weeks. So, and fortunately, I have some time. I have about 6 weeks until then. So I'm really hoping that the overall, birthing and the health of the fetus would be optimized by the time the final healthy stage of birthing actually happens. And of course, at the same time, we can help with labor preparation as well for the mother. So the mother is extremely ecstatic because she was released from the hospital, because the reports normalized after about 6 to 7 days completely. So they said that now there is no need to, keep you here, keep you in the hospital. There's no point of that. She was discharged. She was sent home, and they are very happy that this crisis was averted, effectively with homeopathy. I do wish, although, that she had come to me immediately when the IUGR was suspected or diagnosed. It was a delay of about 3 weeks, and I do wish that I had that time, and I had that. We didn't waste that time, but unfortunately, we have what we have, and we have to deal with whatever stage the patient comes to us. But I did inform her that please consult at the right time and don't delay in such cases, because, of course, time is of the essence, in such cases, and we cannot just expect good results if we don't have enough time sometimes. But in this case, it was a good result, and the mother's body also reacted well to the remedies, and we got this favorable result. So that's all for today. And this was a very interesting and a very evidently quick recovery that I wanted to talk about from my recent cases. And I hope this is useful to you as well. I hope you can keep it in mind that homeopathy is not just, for something that is slow conditions, or conditions that need slow recovery. It's not like that. We can address these kind of crisis situations as well with homeopathy, and much more effectively than any other system of medicine can. So this is Dr. V, and I am with the Homeopathy 24/7 team, and I was talking to you today about homeopathy and pregnancy, and how we can address all kinds of situations in pregnancy with homeopathy completely naturally, and without, taking uh, drugs with side effects, and drugs that are not, that are known to cause harm to the blood-brain barrier, as well as they are known to pass to the fetus as well. So we would like to obviously avoid that. We would like to avoid exposing a young life at that stage to things that can be detrimental to their health in such a sensitive and early stage of life. But with homeopathy, you have a chance to address such things completely naturally and effectively. Of course, in consultation with a professional homeopath, I would never suggest you to self-prescribe in such sensitive states, because you do need, a helping hand, a hand who has some experience in the area, so that you are guided very well, and so that your results are as favorable as this case was. And I'm sure many homeopaths, can maybe able to help you. If you already have a homeopath, you can always discuss with them as well. So, signing off today with this beautiful case, and I hope to come back soon with more and more cases relating to pregnancy, infertility, and homeopathy. Have a wonderful week ahead.